thoroughly. So, here are some causes which can lead to the vomiting. First of one is renal failure. Second one is in raised intracranial pressure and ear disorders, gastric outlet obstruction, and vomiting also occur in pregnancy and in psychological cases, and also in case of food allergy. So one by one, we discuss if a patient present with vomiting and also he has the following symptoms such as he has nausea, vomiting, fatigue, and is a known case of hypertension and diabetes, and he experienced pruritus. Pruritus will be due to increased urea level in blood, so due to uremia. Raised jugular venous pressure, and along with that patient may be drowsy due to uremia. Due to uremia, and there may be history of renal colic, burning, micturition, frequency of micturition, or hematuria. The patient will also present with anorexia, vomiting, and easy fatigability, and these are usually presenting symptom along with vomiting. And the patient may also present with oliguria and puffy face. Puffiness due to swelling all over the face and also with pedal edema. Patient also complains of breathlessness, which is exertional initially, and the later on and later stages, the patient at rest experienced breathlessness. Patient may be drowsy, restless, and may have fits. Uh, Now we talk about the signs. The patient will be pale, and and his face will be puffy. Blood pressure may be high, and jugular venous pressure may be high due to fluid overload. Muscle wasting is may be present. When we perform investigation, the HB will be low and the anemia will be normochromic and normocytic. Hemoglobin and HB level. The reason of low HB in renal failure patient is that the kidney produce 90% of erythropoietin, which triggers the bone marrow to produce blood cells. In case of renal failure, when kidneys are unable to produce erythropoietin, then there is a low synthesis of blood cells. That's why the patients of renal failure experienced low hemoglobin and anemia. In urine complete examination, the urine may show proteinuria, RBCs, pus cells, and cast cells. In this patient, blood urea and serum creatinine will be raised. Uh, in And we also perform serum electrolytes. In serum electrolytes, sodium and potassium will remain normal until unless the GFR, glomerular filtration rate, is reduced to less than 10 milliliter per minute. After that, the patient may develop hyperkalemia due to decreased in excretion of potassium. On the other hand, calcium will be decreased and phosphate and alkaline phosphate are raised. These reflect renal bone disease. Uric acid may be raised in that patients. On ultrasound, renal size and cortical thickness can be measured. Hydronephrosis can be seen. Renal stones, renal masses, bladder masses, and prostate are visualized. In end stage renal failure, kidneys are small except in diabetic nephropathy, amyloidosis, and polycystic kidney disease. X-ray of plain X-ray abdomen will visualize radiopaque renal or ureteric stones, which could be cause of renal failure. Cystoscopy and retrograde pyelography are sometimes necessary to determine the site of obstruction. If a patient present with vomiting and also show the associated symptom which I already discussed, so we can differential diagnose him and we can make a provisional diagnosis of renal failure of that patient. Other case may be raised intracranial pressure. If patient present with vomiting, might be he has raised intracranial pressure due to presence of any space occupying lesion, which could be a tumor or abscess or a hematoma. So basically, the intracranial pressure may be acutely or transiently elevated in stroke and meningitis. So along with the vomiting, patient will present with the following symptom, which could be listed as headache, which would be prominent symptom and is felt all over the cranium. It means a generalized headache, not a localized. And the headache intensity of headache will increase on straining, bending, and cuffing. The other major symptom, yeah, diagnostic point is that the headache will be worst in the early morning. The other diagnostic point is that the patient who has raised intracranial pressure will complain that he experienced vomiting suddenly without preceding nausea. And this could be due to the stimulation of vomiting center in the medulla, which has a weak blood-brain barrier. And in that case, patient may present with epilepsy and other neurological deficit or disturbed consciousness. When we talk about the signs, the features of Cushing reflex may be present, which would be that the patient will experience, yeah, will show bradycardia, hypertension, and irregular respiration. Conscious level of patient may be disturbed due to space occupying lesion. The patient may have neurological deficit, which could be hearing loss, facial weakness, droopy eyelids, and decreased facial sensation. In that case, if we notice, if we examine the following signs and symptoms in the patient along with vomiting, we perform the following investigation, which could be X-ray skull, which show the intracranial calcification. And when we go more specific, then CT and MRI will show the site and possible nature of intracranial lesion. That's how we can differentiate a patient with vomiting. Either he is a patient of renal failure or a patient of raised intracranial pressure. The next one is the ear disorder, which we also named as labyrinthine disorder. Basically, in case of ear disorder, patient who come with the complaint of vomiting also complain about that he feel vomiting, yeah, he has vomiting whenever he perform head movement. So vomiting is associated with vertigo, dizziness, which is generally precipitated on the change of posture. And along with that, patient will complain about tinnitus. Tinnitus is a ringing sound in the ear and deafness. Positional nystagmus may be present in that patient, which is the repetitive and uncontrolled eye movement, and the patient may complain about the mild deafness. So we, in that case, to confirm our diagnosis, we perform caloric test, which show the impaired vestibular function. To check and we perform this test, yeah, or investigation to check symmetry of responses between right and left ear. The next one, cause of vomiting could be pregnancy, and in case of pregnancy, there will also be history of amenorrhea. Vomiting mostly occurs early in the morning in case of pregnancy, and to confirm the diagnosis, we perform pregnancy test and ultrasound, and this will confirm the diagnosis that the vomiting is due to pregnancy. In case of the other cause could be food allergy. So in case of food allergy, vomiting is associated with the particle food. And the history of other allergic disorder may be present, just like the history of rhinitis, asthma, and urticaria. And the last one the last one cause could be the vomiting. So, of vomiting could be psychogenic vomiting. In that case, the patient there is a history of prolonged vomiting without any weight loss, and also we can see the history of emotional disturbance. The patient may be seen depressive and stressed out and in anxiety. Clinical examination investigation in that patient would be normal, and this should be the diagnosis of exclusion. So that was all about the differential diagnosis of vomiting. If a person present with vomiting, we can't make any diagnosis just on the basis of vomiting. Other than that, we have to examine him or her thoroughly to check out the other sign and symptom which could be the major signs. On the basis of that, we could make the provisional diagnosis, and then that after making the provisional diagnosis, we perform specific investigation to confirm out either he is suffering from a specific disease or the other. Thank you so much.